Quadriceps strains or ruptures are most likely to be seen in the rectus femoris, which is the muscle that is most susceptible to the strain. These muscles are less commonly going to be strained than the hamstring. There is a primary mechanism of injury as well as secondary. The primary includes just an acute strain, maybe during a run or a jumping activity. But then there's the second primary, which is the eccentric load. So this is when you have a force stress being applied to an eccentrically tensed muscle, such as in forced knee flexion. So this occurs during takeoff and landing from jumping. It may also be similar to kicking a ball while on the run, such as during soccer. The secondary mechanism of injury is a direct blow to a contracted muscle. Signs and symptoms are going to be grade dependent, grade 3 being the worst. And with a grade 3, you will initially palpate a depression in the muscle, quite possibly. There may be a proximal bulging of the muscle during contraction. And if there's a lot of edema, it may actually mask that tear. There will be in all grades a localized point tenderness. The person will probably be a bit dysfunctional and will have a painful gait. Range of motion will include limited active and passive knee flexion, as well as hip extension. Manual muscle tests will be grade dependent, but for the rectus in a grade 1, it will be strong and painful contraction. In grade 2, it will be a weak and painful contraction. And grade 3, more likely to be weak and painless because the muscle has completely ruptured at that point. Diagnosis is going to be severity dependent.